Good afternoon. My name is Annalise Poets, manager of the KT Core for NeuroDevNet. We welcome you all, and it's my pleasure to introduce Dr. David Phipps. David is NeuroDevNet's KT Core lead and joins us today to talk about the use of social media for knowledge translation. Thank you, David. Please go ahead.
Thank you, Annalise. Thanks for the introduction. Thanks for setting all of this up, and thank you to the participants who have joined us. We've got the next hour to talk about social media and knowledge mobilization. Since I am the head of the Knowledge Translation Core, every time I say mobilization, you feel free to hear translation. To me, the terms are interchangeable, and we can certainly talk about that towards the end. Now, Annalise, yes, I can do. So we're here to talk about social media. I often will start out with a question like, so what is social media? But it's been around for so long, I don't think we're really going to talk about the definition of social media. But I've just opened a poll, or Annalise has opened a poll on the right-hand side, and here's some examples of different social media channels. And I'm just asking you, which do you use? And this is you use for your personal life, not your professional life. But if you could click all of these that apply, and which of these channels you use in your personal life, I'm going to give about 20 seconds. You'll see the votes are tabulating on the right-hand side. I'll give about 10 more seconds for people to log in and to let us know what types of social media channels that they're using. Another few seconds, a couple more folks are going. Things like Twitter, Facebook, YouTube are very popular. They seem to be popular even though we didn't necessarily put them in that order. I'm going to end the poll now. And the voting is closed, and you can scroll down and see that 95% of the participants are using YouTube, 90% use Facebook, 60% LinkedIn, 55% Twitter, 0% use SlideShare. We hope that that's going to change after today because, as Annalise mentioned, these slides will be available on the SlideShare account for NeuroDevNet. SlideShare is a content curation site where we post both slides, PDFs of slides, but also of documents that we wish people to have. And it's easy because you can post your slides and just send a link, and it's a social element, so you can also get some commentary back. So that's really interesting. If we keep in mind that Facebook, YouTube, Twitter, and LinkedIn are the most popular, and with the Pinterest being 45% the most popular, I'm going to go to the next slide. And we see actually the same thing, the same channels, except, Annalise, I wonder if you could get the next open poll up, which is how many of these do you use in your research and in your knowledge translation activities? So if you could vote, again, using the right-hand side, which of these social media channels do you use for research and knowledge translation? So if we remember, the top ones were YouTube and Facebook and Twitter, LinkedIn, and Pinterest. I'll give you about 10 more seconds. Excellent, Annalise. I'm going to end the poll. And so we can see here, and this is what's quite interesting. You will recall that YouTube and Facebook were in the 90 and 95 percentile range for those of us who are using social media in our personal lives. But for our research in KT, for our professional and our training lives, it's quite a bit less. 65% use Facebook, 45% YouTube, 40% Twitter, 50% are using LinkedIn, and that's not surprising because LinkedIn is branded as a professional site. And it's interesting, 40% of you use Pinterest in your personal lives, 0 are using Pinterest in your professional life. So what we're seeing here is that there is quite a lot of uptake. There's more uptake for social media in our personal lives than there is in our professional lives, but there's still quite a lot of activity, and we're going to talk about what that activity might look like. I'm a big proponent of the use of social media for knowledge translation and knowledge mobilization. My main Twitter account is at ResearchImpact. I've got close to 7,000 followers there. Very active in blogging and in LinkedIn as well. We're quite active in LinkedIn. Interestingly, we're not on Facebook. as the Research Impact is a network of 12 universities who are investing in institutional supports for knowledge mobilization, and we have chosen not to be active on Facebook. And I'm happy to come back to that at the end because it was for us a strategic decision that we made. Before I move on to the next slide, if you have any comments, feel free to type them in the comment box on the lower part of your screen, and Annalise will speak up if I have missed a question that is being there. So please feel free to enter any questions that you have. So here's a little bit of theory. This is my simple theory of what knowledge mobilization or knowledge translation is. And it's we come from the position that those of us who work on campuses work in a different space than those of us who work in community. And by community, I mean anyone that is not working on campus. So this might be industry, it could be government organizations, nonprofits, NGOs, faith groups, it could be labor organizations. So anyone that is not working, working with a campus-based partner. And all that knowledge mobilization or knowledge translation is a set of services, it's a set of functions and practices that help bring community and campus partners into a shared space of either collaboration or knowledge exchange or knowledge translation. I see, Glynis, you've got a question. I'll come to that just in a second. Thank you for the question. And so knowledge mobilization helps bring community and campus partners together into the shared space of collaboration or knowledge exchange. And sometimes when we do that work, innovation occurs. I've got social innovation here as an example, but other types of innovation are possible. If we think that impact and innovation is what we want to achieve, then knowledge mobilization is one of the mechanisms or how we go about achieving that. And my simple definition of knowledge mobilization is it helps make research useful to society by supporting engaged scholarship from inception to impact. Engaged scholarship is scholarship that is engaged with non-academic partners. Glynis has a question. Do ethics boards allow for research KT on social media now? Research and KT on, so social media is absolutely, Glynis, if I understand your question right, social media is an eligible way of disseminating, it can be claimed in your ethics protocols as one of the ways in which you would disseminate the opportunity to participate in a survey or to sign up as a participant. So using social media as a recruiting tool is an eligible, we do see that actually quite a lot in research ethics submissions right now. Glynis says, I mean for sharing research results, engaging participants. Yes, engaging participants, yes, and sharing of research results very much so. Social media is a way of amplifying the message, whatever your message is. And if, for example, if you've got a Twitter account and you publish a paper, you can actually publish a link to that paper either on the journal's website, or if the journal allows you to put it in your institutional repository, you can submit, you can use that link to then tweet out your paper. So research results, social media is a way of amplifying research results. I haven't seen social media being used as a primary form of dissemination. It's usually a form of amplification. Thank you for the question, Glynis. Happy to take any other questions as we roll along. So that's my theory slide, a little bit of theory. And now we move on to why use social media. This is the 5 C's of social media: collaboration, content, context, connections, and conversations. But if I just mentioned to you, and I have, that knowledge mobilization is a way of bringing community and campus partners together to work in the shared space of collaboration, then collaboration is one of the mechanisms for knowledge translation. It is the content on which we collaborate, and then the context. Annalise, I'm actually moving my cursor. Can you see that? No, she has to unmute herself.
Yes, I can see that, David.
Excellent. Thank you.
I'm not sure if others can see it though.
Okay, so I'm starting with collaboration. So we collaborate. Okay, thank you, Glynis. It is the content on which the content is what we collaborate on, and that content is placed in context. So we collaborate in context-specific ways, and in that context we create connections between researchers and trainees and partners who would be from clinical or social services or industry or policy shops. We create those connections, and those connections allow us to have conversations. So you can see that if social media is based on these 5 C's, it is also a way that we can also collaborate, or we can also use these 5 C's for knowledge translation. So therefore, social media is a useful tool for knowledge translation. It allows us to disseminate our knowledge in an iterative way, so we can go back and forth. It's not the typical Web 1.0 version of publishing. It is actually engaged, gives you opportunities to engage in discussions. It builds communities for collaboration. It gets academic research into the hands of people who can use it, so that was Glynis's question. And it allows academics to connect to research partners. So this is why, having looked at my theory slide and at that arrow between community and campus, this is how social media can be used as a tool to help that arrow work between community and campus partners. So moving on, why develop a social media strategy? I'm going to ask the group a question, and I'm going to ask the group, what is a strategy? And if someone can type in the lower comment box and tell me what they think a strategy is. Thank you, Nina. Thank you, Madeline. I see you're typing. While you're typing, I'm going to have a sip of tea. Good thing we don't have a webcam. So Nina, a plan to achieve a desired goal. Excellent answer. Madeline, a systematic use with regards to new papers and publications. Madeline, hashtags and retweeting. I would say that those are part of a strategy. They're not the definition of a strategy themselves. I'm going to come back to what Nina said. It's a plan to achieve a desired goal, and that's an excellent answer, because a strategy is just a plan, and one of the things that we're going to talk about shortly is the goal of that strategy. And we need a strategy because it helps you avoid the shiny object syndrome. I'm going to come to what the shiny objects are. And it's thoughtful and strategic. Strategic means that we can create yes or no decision points. And that's the point of strategy. A strategy is a tool that allows us to make a decision as to whether we're going to invest our resources, and that's money and time and people and space and technology. Are we going to invest it in choice A or choice B or choice C? And that's the point of the strategy. It allows us to carefully consider what we're doing before investing those times and resources that I just mentioned. It allows us in a social media strategy to plan content and schedule it. We're going to talk a little bit about that because it's very important that our content be well thought out and well executed. And it identify who is going to be doing that, and importantly, manage the expectations. Tammy, a research protocol is exactly a strategy. Very correct. Anytime anyone says, if you're a researcher or a trainee and you've ever had to write a research proposal, if anyone says, have you ever written a strategic plan, you can say, yes, I have. And you can present them with your grant application, because the grant application identifies what are your objectives, what are the specific goals under that objective, what are the activities you're going to do to achieve those goals to help you meet the objective. You have to budget out in terms of time, in terms of funding, and you have to identify what resources you already have to bring to the table. So a research proposal is exactly an excellent example of a strategy. So a social media strategy, the things you need to consider is the team. Who's going to be doing this? We're going to talk about that. What are your goals? What do you want to accomplish from your social media strategy? Who are the audiences that you're going to engage with your social media strategy? The current conversation is my favorite and most important piece that if you ever need to take a sip of coffee now, because I'll get to it in about 15 minutes, you need to be awake for something, be awake for the current conversation, and then we'll talk a little bit about selecting tools. On the right-hand side, I'm not going to talk about the content measuring success, name and design or evaluation, just because of time, but I'm going to cover the 5 bullets on the left-hand side. If you need, take a sip of coffee now. So the team. It's really important that if you're working in a group setting, and I think many of us are, because we'll be working in a lab type environment or a clinical environment, it's important that the team is engaged in the social media. It doesn't mean that everyone on the team must be active in social media, but everyone on the team needs to be aware that there is a social media strategy and that there is the opportunity to engage with that. So it's important to put the team together and have the team at least aware and identify the responsible people. These are the person or persons who are going to have the primary responsibility for populating, maintaining, and monitoring your site. It doesn't take a lot of time. This is not necessarily a full-time position. I do most of my social media on the bus on the way in the morning and the way out in the afternoon. I probably don't spend more than 15 to 20 minutes a day on my social media channels. But it's important that I am the one identified to do the work and that I have carved out time to do this work. So again, it's not a full-time position. It might be a function, it might be you as a graduate student being the social media lead for your lab group. It might be you as a graduate student who is the social media the person responsible for your own tweeting, for tweeting your own research. But again, I'm going to come back to what Glynis says. If you are engaging with your stakeholders as a part of a research protocol, then that does need to be put into your ethics protocol and be part of your informed consent form. And then also ensure that the team has the time and enthusiasm to devote to this project. So I am going to, Annalise, if we could have the next poll up, please. Because the question I'm going to have, and it's a free-form question, is how many people on your team use social media? Oh, that's right. Annalise is going to tell me that we don't have that as a poll function, but we're going to be entering it as into the comment box down below. Is that right, Annalise?
David, nope, we've got
yes?
the poll open, and people are entering their answers.
Oh, right. Thank you very much. Thanks, Annalise. So you will see on the right-hand side, how many people do you have on social media as part of their job? And I'm going to, that's really interesting. I'm going to hang out for another 10 seconds, take a sip of my tea. It's a good thing my mama taught me not to slurp my tea. Otherwise you'd all hear a nasty sound. Okay, I'm going to end the poll and we're going to take a look. The most popular answer is nobody. So that's really interesting. Nobody is part of your social media team. And but then what I find interesting is that 2 is a more popular choice than 1. So this is suggesting to me that there are a number of folks who are working in a team-based environment. And some folks have got more than 4 people who are doing social media. 11.5% of the folks on the line have got more than 4 people. I'm going to ask some of those 11.5%. If you voted, if you indicated you have more than 4 people, could you please type into the comment box below and just give us a little bit of detail about who are those more than 4 people and what they look like and what kind of roles do they have both in the team and on social media. So if you were one of the folks who clicked more than 4, I invite you to use the comment box below where I am typing right now. And tell us what that looks like in your team-based setting. Nope. Okay, that's fine. What I can tell you is certainly under a team at York University's Knowledge Mobilization Unit, we have 3 of us who are active in the Knowledge Mobilization Unit on social media, and we each have very specifically identified where we tweet and when. So the ResearchImpact Twitter handle is really for the network of 12 universities. I'm the primary tweeter there, but each of the 12 universities has an institutional knowledge mobilization handle. So at York, we are KMB York, at KMB York, and Michael Johnny, the manager of Knowledge Mobilization, is the primary tweeter of that account. And then each of us have our own Knowledge Mobilization Twitter identities. Michael Johnny is Mobilize Michael, Krista Jensen is Atomic Kitty, and I am Mobile Mobilizer. And we've very specifically decided where and when we tweet. So if Michael wants to tweet about golf, and bless his heart he does continually, more than he tweets about knowledge mobilization, he tweets as Mobilize Michael. But we use for primary York content, we use KMB York, and for the broader knowledge mobilization, knowledge translation, social innovation space, that's where the ResearchImpact Twitter handle comes in. Annalise, and for NeuroDevNet, at NeuroDevNet is run by Bethany Becker, the communications manager in Vancouver. So thank you for that addition. It's important to identify who's going to be tweeting and give them their specific roles. So this is a conscious discussion. Don't assume that someone else is going to do it. We want to avoid the gaps. Okay, moving on. So the goals. This is a very important part of the social media strategy, and it's what are you wanting to accomplish. So if you've ever read or written a research proposal, you will know that research proposal usually starts with an overall objective, and then it breaks it down into specific goals underneath that overall objective. So that's the same as with the social media strategy. What are the goals you're hoping to accomplish by your social media presence? Is it communications? Is it about finding partners to collaborate with? Is it, if it's approved by your research ethics board, is it engaging with potential participants in the research process? And you may want to do all of these, and different tools may have, different tools do have different uses. So, and we're going to come to that towards the end. So thank you. Some folks have already started the question of name one goal of your social media strategy. And on the right-hand side, I invite you to type your answer there to what is one, for those of you who do use social media for research and knowledge translation activities, type in what is one goal of your activity. And without telling you, you will know I'm taking a sip of my tea. Okay, just leave 10 more seconds. In your minds, you should be hearing the Jeopardy clock counting down. Okay, thank you. For those folks who have provided information, I'm going to end the poll. And if we look down, we see disseminate information about recent studies, recruitment, disseminate key findings again. There's one on engagement, promote evidence-based research in the field, raise awareness, collaborate with stakeholders, make results available to parents. I'm going to come back to that one. Link research with patients, so that's a stakeholder outreach, promote into families and healthcare providers, and again, recruitment. I'm going to ask the person who said make results available to parents. Would you be willing to type in the comment box below the slides and tell us a little bit more about how you see that as a goal, and if you're actually already using social media to do that? That's the person who said they want to make research results available to parents. Pia, thank you. Just a little pause while Pia types about how she is. So how results from the research can modify what we tell to parents. So are you, and let me ask, are you currently using social media to do that? Or is this a plan that you have? Excellent, thank you. I'm glad that's in progress. And if you need any assistance with that, the KT Core is here to help. Once you've had a chance to see the different tools that we're going to talk about in this webinar, we'd be happy to talk to you a little bit more about that. You would get in touch with Annalise Poets, who would be able to start that process. And to show parents the outcomes of the research they participated in. Thank you very much, Mega. So Annalise is typing. There's her email. Thank you very much. If you want further assistance after this webinar, apoets@yorku.ca. So moving on, the audience. Who do you hope to reach? So clearly for Pia and Mega, it is parents are one of the audiences that they wish to reach. It's really important that you align your tools with the audiences that you want to reach them. This is why we didn't choose Facebook. We went out to our stakeholders and we talked to our stakeholders about their use of social media. And our stakeholders use Facebook, but mostly for personal reasons. They don't use it for professional reasons as it relates to our role as a knowledge mobilization unit. So we decided not to use Facebook as one of our tools because our audience wasn't there. So the exercise on the right is to name 1 to 3 audiences for your social media. If you could enter that into type your answer here, and we'll see what different types of audiences. We already see clinicians, families, and educators. And I'm wondering if there are others, other organizations. There clearly are others. Okay, 10 more seconds. You should be hearing the Jeopardy theme song in your head. Annalise has made me swear not to sing it on this webinar. I'll probably get some trademark or copyright violation if I did. Okay, I'm going to close the poll. And we can see there's parents, community members, policymakers, stakeholders, the layperson, experts in other fields. That's really interesting. I'm going to come back to that. Stakeholders, policymakers, families, patients, other stakeholders, clinicians, family educators, caregiver organizations. I'm going to ask the person who wrote researchers in other fields. I think that was it. Other researchers. For the person who, or the people who wrote other researchers, I'm interested to know if you're currently using social media to reach out to other researchers. And if you are, could you tell us a little bit about that by typing in the comment box? John Aspler is typing. Thank you, John. I asked this question about other researchers because there is a growing cadre of researchers that are on social media, and there's actually growing, there's quite a lot of blog literature about the use of social media. You can look, if you Google academic blogging, I'm going to write that down in here, academic blogging, there's actually quite a lot of blog literature about academics who blog and the various reasons why they blog. John Asper says, mostly using Twitter, the goal to be either communicate with people outside my field or networking. Excellent. Madeline does not really to make new collaborations, but perhaps to ensure citations from those researchers and visibility of our research. I love visibility of our research because, Madeline, to me that says that is a goal of your social media strategy, is to create more visibility for your research, and therefore you have chosen social media as one of the tools to allow you to do that. Thank you for sharing that. So I'm going to move on. This is where your coffee should have kicked in. I told you to take a sip of coffee 10 minutes ago. The current conversation, and this is why I think, Annalise, don't open it yet. Oh, okay. If you could close it, that would be. So, we're back to goal. Thank you. So the current conversation. I often get asked, how do I drive traffic to my site or to my social media channel? And my answer is always, that's the wrong question. It's the wrong question because just by setting up your Twitter account doesn't mean that anyone's ever going to come to see you. If you build it, they're not necessarily going to come. The current conversation is, where is the traffic that is already happening? So I answer, the actual question that you should be asking is not how do I drive traffic to my channel. It should be, where are the channels that is where the traffic is already at or active in, and you become active in those channels. So if you know that your stakeholders are active on Twitter, then set up a Twitter account. But rather than just expecting people to follow you, you have to become active in the existing current conversation. And eventually, over time, by you being active in the current conversation, by retweeting, by commenting on blogs, by reposting other people's materials, by linking to Facebook or liking people's SlideShare or YouTube channels, eventually people will see you and people will come and follow you, and you will become part of that current conversation. But it all starts with listening. It's very important that you start to listen to identify where that current conversation is. And if you know the stakeholders, if you've got collaborators, other academic collaborators or collaborators in industry or social care organizations, talk to them. Find out where they're active, follow them on Twitter, become active in their LinkedIn group, comment on their LinkedIn discussions. That's because then you'll know what people are already saying, you know who is saying it, you know what tools they're using. And that's going to help you decide which tools you're going to use and the type of content you are going to present. So Annalise, if you could open up the poll to slide 11, what I'm going to ask you is, what is your stakeholders' current conversation? You can tell me that by telling me what channels they use, but what I'm more interested in is what did they do on that social media channel? So if you could take some time to type your answer on the right-hand side, it'll be a question. Your question is about what are your stakeholders currently doing on social media? So I see they're using Facebook. Thank you for the people who have said Facebook and Twitter, but if you could also tell me what they're using Facebook for. Are they using it, for example, to broadcast opportunities or events? Or are they using Facebook to engage in conversations with a thought leader? Or are they using Facebook to recruit participants into a research study? I'll give you 10 more seconds as the non-copyright infringed theme of Jeopardy goes down, is sung. Okay, I'm going to end the poll. We're going to take a look. So parents in Facebook groups talking about challenges of parenting kids with neurodisabilities, local hospital media, ask questions, tweet relevant academic articles and news, live webinars, a lot of good news stories relating to the field of spinal cord injury. Thank you. Parents using Facebook to talk about the new findings in research. I'm going to come back to that one. So there's lots of good, so what this group is these answers is showing that often used Facebook or Twitter are the most commonly talked about channels, and there's a variety of uses. But if the person who wrote parents using Facebook to talk about the new findings in research, could you tell us a little more about what that conversation is, what you have seen posted on Facebook about research, and how the parents are engaging with it on their Facebook page? Thank you, Clemens. So Clemens, it said parents are trying to understand better what is happening to children. And do I understand it on Facebook then they're discussing the research that they have seen? Is that correct? Excellent. Here's a little tidbit though. It's interesting. As you consider becoming active on Facebook, it's important that you consider how you are presenting yourself, because parents may be looking to you as the expert, and it would be important that you consider if you are comfortable in that role. If presenting yourself, if not presenting yourself as an expert is part of your goals and strategy, then you might want to say that you're there as an interested stakeholder. You might want to identify you're there as a researcher, but that you know, especially if you're not a clinician, that you're not necessarily providing clinical advice. So it's important that you, for your own integrity, make sure that you stick to that area of expertise or that use of your social media. Tamara's typing. I'll let Tamara's question come up before we move to the next slide. You know, I was talking to a group in Australia about social media, and there was one group of researchers who were active in vaccines, and they were getting a lot of heat from the interested stakeholders, or the stakeholders interested in the ties between vaccines and autism, whatever you believe on that side of the story, and they had chosen to not be active on social media. They just did not want to expose themselves to that discourse. Tamara agrees, even as a clinician, you need to balance where it is appropriate to give advice to parents when you go to social media or for Facebook. And it is, thank you, it is a comment, a very valid comment. And you do need to, if you do, not using social media is a perfectly good choice. But so long as you have thought through the reasons for that choice, and you can justify, if ever asked to justify why you're not on social media. So don't feel that you must be on social media. Thank you, Madeline, that you agree you cannot give medical advice via social media. I think that's a very important position to take. So selecting specific tools, we're coming up to the shiny object syndrome. Now you know your goals and your audience and where the conversation is, you can start thinking about which tools to use. It's important, and I'm going to reiterate this later, that less is more. It's important that you are strategic in your choice of tools and you don't decide to start using everything under the sun. You want to map out which tools are going to work, because this is really too small. It works great if it's blown up by 40 feet by 40 feet and if I'm in a lecture hall. But this is the conversation prism. There are hundreds of social media channels that you may choose to use. And I must say that of all these hundreds, I am active on Twitter and LinkedIn, SlideShare, YouTube, and that's about it. I'd say that's about it. Annalise will correct me if there's something else that I am not personally active on Facebook for my work, but I know that NeuroDevNet is. So this is why it's easy to get swamped by the shiny object, because all of these are cool. All of these have neat features that we really think would be very cool one day if only I had that social media channel. So I'm going to sign up for it now. And then what? It's important that you consider your content. Oh, I heard someone else, some other voices. Thank you. So it's important that that you don't chase the shiny object, because there's a lot of cool stuff out there, and this is why you need the strategy. You need the social media strategy, and you need to know where the current conversation is, just so that you can help choose those 1, 2, 3, or 4 tools that you want to use for very specific opportunities to avoid the shiny object. And not everything you're going to try works. We took a serious kick at Pinterest a couple years ago. Pinterest is a social media channel that it sort of is, instead of a tagline or a hyperlink, the hyperlink is actually a picture, and clicking on the picture takes you to the web page of the picture, and you can put in commentary, and there can be comments back and forth. We really thought Pinterest would be interesting to explore because it provides visual learners with a different way of getting into our content. Annalise says, I have heard advice given to register your name on channels even if you don't use it. Yes, I'm coming back to that, Annalise. Okay, so I'll approach that now. While I have said it's important to be selective on your choice of social media channels that you use, I also think it's equally important that you register your name on many social media channels that you think at some point you might want to use. Even if you don't think you're ever going to use Pinterest, it's important that you get, or for me, it's important that I get ResearchImpact as a Pinterest account, because I don't want someone else starting to post as ResearchImpact on Pinterest. It's important to reserve your naming rights and your branding rights on the social media channels, because the last thing you want is a porn star to be calling herself or himself ResearchImpact and presenting those pictures tied to the words ResearchImpact. So I advocate that it's important to secure your naming rights, but as Annalise says, aren't dead channels bad? What I recommend you do on those landing pages is say, thank you for visiting, please find our content posted at, and you provide your links to the social media channels that you are using. So we have a Facebook page for ResearchImpact, and it doesn't say anything more than please see us on Twitter or please see us on LinkedIn. So that you've reserved your name, but when someone comes to the site, they're not seeing a blank page. So it's not bad to not use their social media site so long as you've directed your audience to where the social media conversation is. I'm going to pause there before going on to the next slide and just see if anyone has any questions or comments they wish to type underneath in the chat box underneath the picture. JP is typing. You should all be sipping your tea. Oh, JP stopped typing. So JP, I invite you to bring your question or your comment back towards the end. And as I said, less is more. It's really important to start at the shallow end. Now, I often say that social media, getting into social media is like learning to swim. You can't learn to swim by reading a book. You actually have to get in the pool. You can't learn to do social media from this webinar. This only tells you where the pool is. You've got to get in there and you've got to start swimming. But like swimming, do it with a buddy. So pair up with someone who's active in that channel, or do it with a lifeguard, someone who can teach you about that and have some oversight or who can be a critical friend to your channel. So it's like learning to swim. You can't do it just by sitting and reading a book. You've actually got to get in the Twitter sphere, the blogosphere, whatever sphere you want to get into, but do it with a buddy, do it with a friend, with a mentor, and do it in an informed capacity. And this webinar is your first entry into that if you are new to social media. JP asks, what about a website with different degrees of security and a chat box? That's interesting. Certainly we are increasingly seeing social elements built into websites, whether that is embedding your Twitter stream as a widget into your homepage, or going full on to some of these collaboration suites, which are things like Basecamp or O3 or we're on Adobe, right? Adobe's got a product as well. I can't remember what it is. So there are full-on online collaboration platforms. Adobe Connect, thank you. There are online collaboration platforms that have chat functions, have blog functions, have file sharing functions. The advantage of most of those is they usually have various degrees of security, and you can assign people to have different levels of access to the technologies. So that's a little different than social media, which is much more of an open platform of anyone can join within your parameters of, like for Twitter, you need to actively follow people, and you can unfollow some folks. But I think, JP, there is, that's another piece that Annalise and I can advise on, is online collaboration platforms that aren't really part of the social media conversation, but that might be able to be used to help manage a distributed group of collaborators. Ethics of using social media in discussing disease or sensitive topics. Glynis, if you're still online, I'm going to invite you to know it. Glynis Webster is on our board of directors, and she is a specialist in research ethics. And there are, I'm going to refrain from having an opinion on the ethics of using social media when discussing disease or sensitive topics, because I think I would be remiss because I have my personal views, but this is why I've invited Glynis to type. Oh, not me. She's a researcher studying the health effects of environmental chemicals. Sorry, Glynis. I thought you were, there's another Glynis who was on our board then. Sorry, Glynis, and is anyone on the neuroethics core online? That's a good question, Annalise. Because JP, you've come to a very important question, the ethics of using social media. I often say that social media doesn't create any risk that doesn't already exist outside of social media. What social media does is amplifies risk. So the ethics of talking to someone around sensitive information, disease, or sensitive topics, those ethics exist when we're face-to-face or when we're on the phone. Those ethics also exist within social media. The challenge, social media doesn't create the risk, but social media has the potential to amplify that risk. So I would say that the ethics themselves would map onto would map onto social media the way that they map onto interpersonal conversations using other types of media, in-person, telephone, video conference, but that you need to be cognizant that those risks are amplified in a social media setting. John says, I think it's a tough problem. Are you promoting your own research? Does your stream hype or promote that work to people who may misinterpret the results? And I would say, publishing your paper. Are you promoting your own research? If you give, now there's peer review to that paper, but if you give a talk, and whether that's a Café Scientifique to the public or a talk in a scholarly environment, are you promoting your own research? Does that talk hyper-promote that work to people who may misinterpret those results? And I would say that risk exists if you are giving a café scientifique or if you're giving a talk in a public setting. But what social media does, it amplifies that risk because the potential for reach of that misinterpretation is now larger. Thank you, John. Okay, I'm going to move on. Excellent questions. So here's some of the tools that we showed on slides 1 and 2, and some of the things that I have found that they are useful for. Storytelling, resource sharing, disseminating your research, or networking. And disseminating your research is more specific. It's about the research content than telling more general stories. And blogging is a great way to share resources, to tell stories, to disseminate research. It's not a good way for networking. I blog once a week, and I would say that I may get 4 or 5 comments on my blog a year. So it's not a good way for blogging. It's not a good way for to network. But something like LinkedIn, it has only one check mark on networking. I have found that I use blogs to tell stories. I use blogs to sort of put out their early ideas. But if I want a conversation, I use LinkedIn for that conversation. John and Tamara are typing. Do you have analytics built into your blog that tell you how many reads? Absolutely, yes, Tamara. So if you have a WordPress site, then you can get the number of hits that you have, the number of unique visitors, and the global location where they are. So there are analytics that are built into many of these. You can also pay for professional versions of these sites, most of the channels, or something like Hootsuite, which is an amalgamator of your channels, and you can get greater analytics with professional sites. What I don't know is if subscriptions to these sites are eligible expenses on your research grants. A subscription for an academic journal is an eligible expense, but I don't know if a subscription, if anyone knows that, if anyone's tried to put a professional Hootsuite subscription onto their research cost center, let us know. John wonders if both the ethics question selection tool slides lead to what about blurred lines before personal functions and professional functions on one account? You tweet your work, but you also tweet opinions of work topics. So that's partly why, John, we have chosen to stay off Facebook for our professional work. So that we don't blur those lines. It's important that if you're in a social media space, you may choose, so for example, I tweet as @ResearchImpact. It's what I would call a corporate Twitter account. It is not David Phipps's account. David Phipps runs it, but it is not David Phipps's opinions. If David Phipps wants to have an opinion, he tweets his mobile mobilizer. So I think that I navigate those questions by the blurred lines by having different accounts for different purposes. What I would advocate is that you as an individual on Facebook, where you're posting about a party that you're going to or a concert that you've just seen, you may not want to use that channel to talk about the research article that you've just published or that you've just seen. You may want to create a separate Facebook identity for that activity so that you keep those lines. You're not blurring the lines between personal and professional, and also then you're not blurring the analytics. Veronica, can you get analytics on Facebook? I have no idea. I'm not a huge user of Facebook. If anyone knows the answer to that, please type it. Camilla might be typing. Google Analytics can provide you some of the data you need from virtually any website or account. Annalise and Clements, if Bethany Becker was online, she could answer. So what we'll do, Annalise, if you could make a note to ask Bethany that question about can you get analytics on Facebook. If you could ask Bethany and then send that back out as an email to the group after this webinar, that would be great. Nina says info is limited. Excellent. So anyway, so you can sort of see here, I use blogging to tell stories. I use Twitter. Twitter for me is a way of engaging, networking, engaging with people, because I rarely tweet anything that isn't a link to something else. Twitter is a sort of broadcast dissemination, get it out there and engage with other people. I use LinkedIn for the conversation, and then SlideShare I use as resource sharing, and YouTube is storytelling, and it's also a content curation site. Tom has put up how to add Google Analytics to your Facebook fan page. Thank you very much, Tom. Good to see you active in the discussion. Tom Philpott is the Executive Director for NeuroDevNet and is online. I didn't know you were one of the participants. Thank you, Tom. Good to see you. Moving on then, because I want to leave time for questions. This is your name and design. I've talked to you about this, about it's important to secure your naming rights, your design rights, your trademark rights on many social media channels, because you just want to be able to own your spaces. But very important, as I said earlier, that if you're not going to be active in that channel, you just have a sentence on the landing page, thank you for visiting, please find us at, and redirect them to another one of your channels. And David, there was a question from Nadine about using YouTube for dissemination. Oh, thank you. So we do use YouTube for dissemination. It's a, I find that YouTube in and of itself is a fairly inactive, not inactive. You can put something up on YouTube, but you need to promote the hell out of it. Basically, if you want to get your YouTube video seen, sticking it on YouTube is not enough. Remember what I said about the current conversation? That if you're going want your video to be seen by your stakeholders, definitely post it on YouTube, but then make sure you promote that in Facebook or in Twitter or wherever your current conversation is, and don't be afraid to use multiple channels to direct different audiences to your YouTube site. YouTube will be the place that keeps all your analytics and will get your hits for you. People can also comment back, although I find that never happens. If I was Miley Cyrus, maybe they would, but I'm not Miley Cyrus, and so they, so I think YouTube is a great channel, but in and of itself, putting something up doesn't mean it's going to be seen. You need to be able to promote that channel. And just Annalise is typing. Oh, I see. It wasn't checked off, so thank you for that. And Annalise has never been successful engaging via YouTube. That being said, I use YouTube videos, my YouTube videos, both those of NeuroDevNet and those of the Research Impact Group. I use those in the talks that I give because it's really nice for the audience to take a break from David's voice and let them see a video about a success story that we've worked on. For example, the story. Help me out, Annalise. The NeuroDevNet story about the guy with FASD, the FASD story that we have. Anyway, she will get to that.
Hi, David. Sorry, it took me a second to unmute there. Are you referring to Jacob's story?
Jacob. That's what I was going to say. I knew all I had was Jason's story in my head, and I knew that wasn't right. So Jacob's story. Oh, sorry. You tell how we've used that.
Oh, it's okay. So we created a promotional video to both tell the story of what the play is about, and then also to convey some research results that have been incorporated into the script of the play. And so, you know, in that way, I guess you could consider it a dissemination vehicle, but I think what David, correct me if I'm wrong, but I think probably the reason why it was checked off as a storytelling is because it's sort of more of a product that allows you to tell the story, and then for dissemination, like David said, you need to promote it using other channels, because just sticking it on a YouTube channel doesn't really help you disseminate unless people are looking for it and they find it. But you need to do some more active dissemination using Twitter and Facebook and all those other things. But that's the main way that we've used it, is to tell the KT story and then promote it using the other channels.
Great. Thank you, Annalise. And so that ends my formal part of this presentation, and it's now your turn. I invite you to type in your questions at the bottom, or your comments or your stories, whether successful or not, of how you use social media. And as you're thinking about that, check the lower right-hand corner of your screen. What NeuroDevNet KT Core has done is we created what we call a guide of guides for social media. There are many, many social media guides, and what we did was we had a team come together to review a number of social media guides that are available from the eyes of which ones would be useful for researchers and in our space of NeuroDevNet. And we've created an annotated bibliography of about half a dozen of these guides and why we think they're useful and how they're useful for different types of supporting different types of social media. So it's available at the link on the right-hand side on the neurodevnet.ca website. And we invite you to download that. It's available as a PDF. And yes, we have tweeted it. We have done our social media strategy for that guide of guides. And it's, we do know that it's received quite a bit of attention both within NeuroDevNet, but also with some other NCEs as well. And Annalise points out that the guide of guides is organized from beginner level to advanced skills in social media. So I'll give you a couple more seconds for anyone who wants to type in a comment on the comment box. Thank you, Annalise, for setting this up and for providing the technology and the technical support. And I wish everyone good luck on their tweeting. If you are on Twitter, follow at NeuroDevNet for all the latest and greatest from NeuroDevNet. Feel free to follow the NCE Secretariat, which is NCE-RCE.
Your feedback is very valuable to us, and it's used to inform our services and our future webinars, so please be sure to fill out the evaluation survey. You can see the link on your screen there. It's a bit.ly link, and if you wanted to fill it out during the Q&A period, you can do that. In case you don't get a chance to fill it out during the Q&A period, it'll open automatically when the webinar is ended. Like I said before, the link to the recording and the presentation slides for this webinar will be sent to each of you in an email. Tom is typing, so I just want to give him an opportunity. Oh, it's a comment. Oh, thank you, Tom. We look forward to hearing from you and seeing you at a future KT Core webinar. Thank you, everyone, and goodbye.